Hi, it's Dr. Vermilyea again from Cognitive Behavior Therapy Associates, and in this blog I wanted to talk more about treatments for obsessive compulsive disorder. So we talked last time about two different types of OCD. One was the pure obsessional type, in which the person doesn't do anything that you can look at or observe in order to reduce their anxiety. There's another type of OCD that we talked about where the person does do something that's observable to reduce the anxiety associated with the thought that they're having. And those are compulsions, okay, or a compulsive type of OCD. The primary treatments for OCD are medication and or treatment with response prevention. Some people don't want to use medication in order to try and control OCD, and some people would rather use medication, and that's entirely up to them. Probably even if you wanted to use medication, exposure with response prevention, which is a very specialized treatment technique, is something that would help you in addition to the medication. Likewise, people who would rather be treated just with exposure many times can experience great benefit to themselves in terms of reduced obsessions and reduced time spent checking and doing other kinds of things like that. But in some cases, if they were to take medication, it can actually make the treatment easier or make it more efficient. Okay? So the treatment itself, if we look at just exposure and response prevention, is this idea. And the idea, whether it's a pure obsession or whether it's an obsession that has a compulsion attached to it, is that you have a thought which increases anxiety. That thought might be that you're going to harm someone, or that something's dirty, or that you're having some doubt about yourself in some way. And usually, either in your head, you try to make that thought go away, or you try to make it go away by doing something. The things that you do to make the anxiety go away become less and less effective over time. So what happens is that you find yourself doing them again and again. And different layers can kind of be added to the undoing of these thoughts, so that people might have to do things in sets of a particular number of times, 3 being popular. People might have to do them a certain number of times and not have that be odd, because odd is often a bad number. So these rituals can develop into very complicated things. Anything from dressing to habits of speech to having to reread things again and again, or not being able to leave your house for an hour in the morning. These kinds of things. So OCD can become pretty disabling. Exposure and response prevention simply refers to the idea that in the hands of a skilled behavior therapist that's really educated in OCD and expert in its application, the therapist figures out, with the patient's collaboration, what kinds of things they could allow themselves to experience without trying to undo it, and without trying to undo it either in their head or with some kind of activity. Now, we ask people then to, let's say, expose their hands to some dirt on the floor of my office, which is not that dirty, and they may experience a great deal of anxiety and want to go wash their hands. But what we do is we take, minutely readings of what their anxiety is, and we watch it rise and we watch it fall, and then we do that again and again. Now, what happens over the course of time is that the anxiety decreases. Not just during that session, but the next time that you go to do it, it doesn't rise as high and it doesn't last as long. So doing this repetitively is actually wearing out the anxiety associated with that thought, okay, or with that contaminant. And part of what we're trying to do is not just expose that person to one particular thing, but to get them to see the overall idea of exposure and how it works. Now, someone who had just pure thoughts, we might ask them to sit down and think about causing harm to someone, their family member or something, and to just hold that thought in their head. And again, that thought is very anxiety provoking because it's nothing they would ever do. But we're asking them to hold that thought in their head and not try to do what it is that the OCD would ordinarily tell them to do, which is to try and make that thought go away, change the subject, pray, ritualize in some way, reassure themselves, seek reassurance from someone else. We just focus on that thought, and that elicits a great deal of anxiety, which over the course of 45 to 60 minutes, sometimes even as long as 90 minutes, will come down. And then we do that again and again, and what happens is that the anxiety associated with that thought disappears. Okay? So that's the fundamentals of OCD treatment. There are a number of good books on the subject. Edna Foa and Wilson wrote a book called Stop Obsessing, which is very good. And I think it's very important that you seek somebody who's skilled in the application of these techniques and very broadly schooled in learning theory as it relates to anxiety, because exposure has to be done correctly. And there's no one-size-fits-all formula for how to conduct the exposure in the most effective way. Okay, so I hope that you'll consult the IOCDF website, which I mentioned in my previous blog, or contact our office or your physician. Okay, so that's the end of the second blog regarding OCD treatment.